In this video, I'm going to show you how to tape for sacroiliac joint pain using Kinesiology Tape. Here I'm using RockTape. Before you start the technique, make sure your client is flexed forwards so there's a stretch through this lumbar and sacral area. You then need to pull their clothing down so the skin is exposed just above the glutes. To start, cut 2 short pieces of 5cm width RockTape and then round off the ends to reduce the chances of the taping catching on clothing and to make the technique last for longer. Tear away the backing paper, make sure the client is in that stretched position, and then without touching the glue side of the tape, apply the tape from the center at a 45-degree angle with a firm amount of stretch up towards the lumbar spine. Make sure the tape is stuck down and rub over it to activate the adhesive and to secure it in place. Place the tape at a 45-degree angle with a firm amount of stretch up towards the lumbar spine. Rub the tape to secure it in place. What we're then going to do is use some wide tape. Here I've got 10cm wide RockTape, and that's going to go across the back of the pelvis. Cut the tape and once again round off those edges to make the taping last for longer and reduce the chance of those edges catching on clothing. Tear the tape from the center to expose the adhesive side, and then you're ready to stick that on the back of the pelvis. As you apply the tape, stretch it with a moderate stretch over the back of the pelvis, and then secure the tape by rubbing over and removing the rest of the backing paper. Rub over the tape to secure it in place. When you've applied the tape, it's natural for the tape to have a few ripples and creases in it. That just shows that the tape is allowing natural movement and is not going to restrict the client's movement. When it's in place, you should notice some immediate changes. For example, bending forwards should be a lot less painful. Thanks for watching our video on sacroiliac joint taping. My name's Daniel Lawrence. You've been watching the Physio channel. If you'd like some other videos on sacroiliac joint problems, have a look on the screen here. We'll see you in the next video.